Hello, everyone. Welcome, welcome. It's CBD with your favorite PhD. Good morning, Dr. Katerina. How
Good
are
morning,
you?
Carmen.
So, Dr. Kat, I know that today's topic is really it's an important topic because, of course, we're going to be talking about our skin, our largest organ, but specifically, what can we dive into about how CBD can help skin issues? And I know a little bit about this, but you're the expert, so I wanted to just really draw upon your knowledge and your expertise about why is hemp CBD good or not good for your skin.
Thank you, Carmen. You're the expert too, and I think we'll talk why in the future. But definitely, that's why we pair well together. First of all, the most important thing that people need to know, and this is biology 101, is that the skin is the largest organ on the body,
Right.
and it is alive, and it takes in everything. I remember when I used to work many moons ago as a skin consultant in natural health and wellness. There were all these, statements that it sits on the surface of the skin, it doesn't go in. And back then they were using, harsh petroleum chemicals, and some
Right.
companies still do. And I'm thinking, oh my goodness, this is so not true. We know so much about transdermal. Transdermal is putting something on your skin. It goes through the dermis into the bloodstream and into your body. It is amazing deliverance. There are recent studies that show that CBD has a great potential to relieve actually various skin conditions. Generally, the body has cannabinoid receptors, as we talked about in our last session, the ECS, or the endocannabinoid systems, and they're densely populated all over our skin, and it comes through for the skin from the brain. And so the other major organs, including the skin, have these receptors as well. But being the largest in our body, this is quite important. And because of that, it can help relieve and have the potential for a variety of things, not just for beauty, because I'm using a product called Bourbon on my skin. It's a oil that's used for pain in the body, massage, soothing. And I always like to experiment. And from day one, when I got a hold of Bourbon, which is a product that you make, Carmen, and I know you do skincare, so this is a very special topic, and maybe at the end you can give us a little statistics on skincare if you have them and if we have time. But I noticed a difference right away. And as you all know, I am a cancer survivor. We did October, and I cannot even begin to say how helpful, not just on my skin, but mentally, because I knew what CBD does. And I knew that when I put it on my skin, that it was helping my scar tissue. Scar tissue has inflammation, it has pain, and it helps. I felt it helped stretch it. Not only does it moisturize the skin because it's an oil, but it goes through the receptors of the endocannabinoid system. And so I have to say, I'm such a big advocate for the topical CBD. And when you know your product, when you know it's pure, when you know that it's organic, when you know that it has no toxins in it, and you know the endocannabinoid system, it is a relief to know that you can heal, especially during a time when you're diagnosed with something that you're told may kill you. So, CBD and skin is a very important thing for me, but so many other ailments that I'm going to talk to you about. In the industry for beauty, it's in the forefront. We're going to see, a lot of companies, if not already, in moisturizers and masks. And at the end, I want to talk about things to look for, because whenever there's something good, everybody wants to use it, and it becomes a household name. But then, we need to be very careful what goes in there. It's not enough just to have CBD, hemp CBD on the label. According to a 2019 study of therapeutic effects of CBD enriched ointments in inflammatory skin diseases and cutaneous illnesses and scars, research that administered topical CBD ointment onto lesions on skin twice daily, actually for 3 months on 20 patients, people who had psoriasis, atopic dermatitis, and scars. The results of the study were that after 3 months, there was improvement in the inflammation and the symptoms of the skin. So it's a small study, but there are studies coming out more and more. But this one was substantial because the people did see, I mean, it's visual.
It's
And you
visual.
can feel it.
Exactly. And I would love to add actually in this moment, in 2017, when I was doing research as I was developing my formula, as back then they expected the hemp CBD, the overall business, to reach 32 billion by 2020.
Wow.
Now, since 2017, I've gone back and done more research, and this is what is astounding to me. Are you ready? By 2026, the hemp CBD skincare industry, not everything that was expected, they were talking about all hemp CBD to reach 32 billion by 2020. Skincare, hemp CBD skincare is now expected to reach $194 billion by 2026.
I don't know why, but I have goosebumps all over my body. That's a big number, and it's a fast growth. It's incredible, Carmen.
Yeah, just the skincare arena, the fact that they're embracing and people are understanding the benefits that hemp CBD can bring to your skin, your overall skin health, is pretty incredible.
So there's going to be a lot of more research, I suspect. And we're all going to see that phenomena that I talked about earlier, where we're going to see, I turn on the television and I see hemp products. And we mentioned this before. We're talking about hemp CBD here. And they're selling it and advertising it. You can get this for $20. You can get it at the grocery store. We've been using hemp seed oil, which is a protein and beautiful lanolin for the body. But CBD is what we're talking about, the cannabis oil. So be very careful, people, if you're going to purchase something. I'm not saying that hemp is not good for you. Of course it is. Great for the hair. It's an oil. But we're talking about CBD, cannabinoid, which is restorative to our wellness and our body and our health. And from there, I want to talk about eczema. So imagine you're using, CBD on your skin, and we need to talk about how to apply it and use it on the skin as well. And you've got eczema, again, as we know that CBD reduces eczema prevalence as it works well to address the endocannabinoid system. Topical for dermatitis and oral tinctures are very important. And the reason why taking it as an oral is important is because there is a gut and skin connection. People who have eczema also have potentially problems with the lining of their intestinal tract, the gut, the whole area. And there's whole reasons behind that. So it's very important that you also take the oil orally as a tincture and as topical, because it moistures the skin, it relieves the skin, the inflammation, it heals the eczema on the surface, but it heals from the inside out within the gut. And here's the other whammy. You also get eczema when you're stressed out. That's the gut stress connection. When we're feeling so stressed out, it can affect everything, our mood, our skin, people start to pick. And so CBD helps to calm us down. So there's a full circle here. And now here's the big one. How many kids and adults, there's teenage acne and adult acne. And there's a research, 2014, there was a research that found this CBD has potential to aid in suppression of the acne breakouts by regulating oil production within the sebaceous glands. this is very important because acne is on the whole body. You can be on your back and on your face. And we get a lot of questions about this,
We do.
about the acne, because people are like, oh, I'm going to put oil on my skin. Is it going to make it worse? The skin gets inflamed. People pick on it. And, people who have acne know that oil on oil is not bad. If anything, it needs to be moisturized. People put very harsh chemicals on their skin to dry it out. And that does not help, because acne has to do with bacteria and so many other things. So the studies are generally showing that the density of the population of the skin is really moving forward. Despite all of these findings, Carmen, there's still a lot of research that needs to be done and investigate of the benefits for the skin, especially because of what you said. And that is because it is a multi-billion industry. And just keep an eye out, because Carmen and I will be bringing you the studies. Now, the risk factors, you want to make sure that the products that you use are third-party tested, that they're pure. If you can get pure, natural, and organic, no pesticides, no molds, and no toxic metals. Why is this important? Transdermal. It will go through your skin. What goes on your skin goes in your bloodstream, in your body. And so I can't emphasize enough the importance of this.
Absolutely. And I think the another note too is to make sure that it is non-GMO.
Oh,
Again, you and I have talked about the importance of the alignment of what you are putting into your body.
right.
You should be aligned with what you're putting on your skin so that it all works together. We are what we eat, but we're also ingesting, or our bodies are absorbing what we put on our skin. And I think, pollution and all of these different factors, we need all the help that we can get. And if there is something that was already designed by nature that our bodies are receptive to, why would we stray from all of that? I have to, it's kind of, in one of my presentations that I did recently about skincare, and I looked at some of the ingredients like you and I have talked about, and there are some companies that are so transparent that they literally say petroleum jelly
Oh, yeah.
on the label. They're not hiding it.
No,
And
no.
people are still putting this on their baby's skin.
And
You
that's a
know,
really good point, Carmen, because CBD, which is what Charlotte's Web has made the CBD very famous, is used for children.
right?
And, it is safe based on what we know for children. We've talked about toxics and risks. And yeah, I'd love to see something in the future about what you just said,
Yes.
because,
You can dive in.
your bottoms get rashes and so forth. Sorry, I just had
Yeah, no,
thoughts
it's,
about
I mean, it's so important to really look and, like you said, to really understand what it is that we're eating
yeah,
and what it is that we're putting on our skin.
that's right.
Um, and also there's the anti-aging components, and there's just so much that we can do for ourselves. It is part of self-love and self-care to look and feel our best. It's the first thing that it's reflected through, in my opinion, is our skin, no matter what age.
Carmen, in mental health, one of the things that, I do when I work with a patient is, you may have all these issues, but unless you're taking care of yourself, there's resentment and so forth. So wake up in the morning, wash your face, brush your teeth, take care of yourself, and love yourself, and use the best for your skin. And I love that you said anti-aging, because our previous episode of endocannabinoids, and what we know about endocannabinoids, it restores balance. It's healing. And I have noticed when I put the oil on my skin a major difference. It is I don't want to say a fountain of youth, but youth in a bottle, and we're going to see more of this coming, and we see it in testimonials. We see it, with our own eyes and with our own experience.
Exactly.
So Yeah, I do really feel that it restores. So if your skin is dry, it's going to look
Right.
older. You know,
Right.
if you need to
Of course.
reproduce more cells, and this is helping bring balance, you
Right.
know, you're going to have more collagen and, you know, a lot more things to be discovered in
Right.
research to come. It's very
Right.
exciting.
It is very exciting, and of course, that's my area that I thrive
Yes.
and I live in. And I think it's also very important. You and I have talked about this. You taught me this, that every body is different, and so different people will react differently. And hemp CBD is not a cure-all. We're not. That's not what we're saying, and we're also not saying that it is for everyone. But what we are saying is that different people have. It might take a little bit longer for someone who is, let's say, older, to see the results. And I think one of the things that I talk about with my customers and my clients is consistency, and continuity is very, very important in the use of hemp CBD.
Absolutely. Thank you, Carmen. Wow, I love it.
We love it when we have people that tune in and engage with us. Sherry, thank you for tuning in and watching, and good morning, Veronica. She's in
Good
the other
morning,
room.
guys.
Thank you for tuning in. We will always, of course, address any other questions that come up. It seems like skincare really seems to be one of the big topics for us, and so please, share the video and comment and continue to ask questions, because that's what we're trying to do here. Every week on CBD with your favorite PhD, also known as Dr. Kat, that's what we're trying to do, is give you a little bit of the insight that we have as we are gathering it together. We want you to be healthy and stay safe and all of that, but we hope that we're adding a little bit of the educational component when it comes to hemp CBD.
Absolutely. And Carmen, as an integrative doctor, it's so important to talk about all the factors, right? So drink plenty of water, get
Right.
good sleep. These are very important for our skin. There are a lot of other factors on how you wash your face and so forth. And CBD is the new and upcoming way of working on healing the skin, providing it with moisture, treating ailments on the skin. But you can't just slather yourself with CBD and expect a miracle. You also need to rest
Right.
water and eat well, because what we
Right.
put in our mouth and what our eat, again, the gut health, the
Right.
gut connection, makes
Exactly.
such a big difference. And so we need to look at the whole thing. And how about you go and you exercise and you're sweating and all the toxins are coming out, and then you drink your water, and then you sit down and you eat chips and all these other things. I
Well,
mean, well, I eat chips, periodically,
exactly.
but it's it has to be the full
Right.
picture.
Everything, absolutely. And if someone does have or would like a consultation with you and your team, how do they get a hold of you?
Well, thank you for joining us, Veronica. Veronica is with us today. She is our medical RN CBD consultant, and she works with general CBD, with the geriatrics and CBD and pain. And then we have Michelle at the office. She is also an RN. CBD consultant, and works more with prescriptions of over the counter with the doctors, in collaboration with myself, who also provides expert specialty advice and consultations, and also use it with mental health as therapies for complementary and alternative medicines. And they can contact us at insightforwellness.com,
Mhm.
insightforwellness.com. And our phone number is 925-216-3510. And I also want to mention that we are offering a special coming soon at the end of this week on our website, 20% off of certain products. And that starting November 19th, there's going to be the Green Plant Summit. Please send your emails, because there are going to be over 25 experts, including myself, I have the lucky opportunity to speak about CBD and cancer, but you're going to learn so many things about green plant from people all over the United States. And I'm offering it free for the 3 days. So email me and I will send you your free pass. And go on the
Excellent.
website later in a week to, and we'll talk about it next week also to get
Perfect. That's excellent. Thank you so much. Thank you for everyone who's tuned in. We hope that you are able to take some of these nuggets and apply them to your knowledge base of hemp CBD. That's what we're here for. Please do share. Again, we love it when you share. We love it when you comment and engage. And thank you very much to everyone who tuned in. And I think Dr. Kat Sherry has sent you her email. So please, we'll go into the comments thread. Don't worry. After the live, we'll address as much as we can. And you can always get a hold of us here on Mondays at 10 o'clock. Thank you so much, everyone. Thank you, Dr. Kat. And we will see you next week.
Thank you, Carmen. Bye, everybody. Thanks
Bye,
for joining
everyone.
us. Emails and Messenger and
Yep.
in everywhere you can reach us, we're here.
That's right. Thank you, everyone. Bye-bye. Have a great day.